This conference will now be recorded.
We all set, clerk?
Yes.
All right. Good evening, everyone.
Good evening.
Welcome to Economic Development and Planning Committee. It's 6 o'clock on May 19th. Do we have any discussion? We got 5 minutes to use. Someone should say something. Okay. If there's no discussion, on to the resolutions. The first resolution has been pulled for a 4-year lease agreement on a copier. The Economic Development Director has decided if people are being laid off and we all have to suffer a little bit, that least we can do is cut back on that. So that's been taken off the table. The next resolution is a resolution scheduling a second public hearing. Montgomery County CDBG Grant, Office of Homes and Community Renewal. And we have a sponsor, please.
Sponsor, Martin Kelly.
Martin
I'll
Kelly.
Seven.
Dan Wilson seconded. Is there any discussion on that? Shall we
What is
move
that
that?
grant
Pardon
used
me?
for? What is that grant for, Chair?
This is a public hearing. It's the second public hearing that's required for a grant that we received for it's just a mandatory second meeting.
Oh, what's the grant for, though?
Dollar General. It's already been in the works. Would you like, it's Ken on the line?
Yeah, I'm on here. Legislative there. It's the Dollar General was awarded through the county a $750,000 grant for machinery and equipment, and that was during the phase where we were doing incentives. So this is just the second portion of that public hearing, so that we can do the drawdown and actually get the money to Dollar General.
Okay, that's for machinery and equipment. That's what I wanted to know. Thank you.
Yep.
All right. All those in favor of moving that to full board?
Aye.
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 All right. Any abstention? Anybody abstaining? Any no votes? Okay, we'll move that to the full legislative body next week. The last resolution is a resolution authorizing the county executive to sign an agreement with Lero Engineers Incorporated for engineering services at Exit 29 redevelopment project.
Martin sponsors.
Pardon me?
Martin sponsors.
You wanted to have, Martin sponsors and Mike Pep seconds. Is there any discussion?
Yeah, what is the attachment? I can't open that. It says I'm denied access.
Ken, can you help us out there?
Yeah, legislative suite, the attachment's actually the proposal discussing the scope of work and the additional tasks that were related to that did the change order. Task 1, which is a part of the document that was attached, was additional construction inspection and asbestos monitoring. And then task 2 was actually demolition design and bid support for what would be the actual demolition on the western side of the facility when we get to that point.
Okay, thank you.
Ryan, I'll send it to you tomorrow.
Okay.
Any other discussions?
Yes, Chair. This is John Thayer. Ken, are we foreseeing any further overruns?
No, as far as legislative affairs, as of right now, this, in all honesty, task number demolition design and bid support, we've got to see where we stand with our budget after we get done with the asbestos abatement. As of right now, we just, so all the legislators are aware, We've spent approximately $4.8 million on the project. We've bonded for $6 million of that. So we have to exactly see after the abatement is done where we actually stand with the remaining funds as far as bonding and how far that can actually take us. So as far as the western side of the facility, we're probably going to be into a phased demolition, and that's all to be determined yet.
We're not foreseeing any further overruns. We had, I believe we had to approve an overrun a few months ago.
Correct. We did, and that was in relation to all the extra work that we had to do in order to get the SHPO to sign off and get the letter of resolution in place with SHPO that they were agreeable to with regards to the western side of the site.
Right. So I'm going to reinforce it that we're not foreseeing any further cost overruns.
As far as the engineering, no, we are not. I like I said, I cannot answer you on the western side of the the demolition portion until we actually go out to bid.
Okay. Thank you. Thank you, Chair.
I would just add to that, John, that one of the biggest issues we face now is, how do we get to the finish line with only 1.2 million remaining, now, what grants can we get? What else can we do to, try to demo what we can? That's going to be a big challenge, but we're getting there.
Correct. Thank you.
Okay, is there any further discussion? All those in favor of the full legislature?
Aye.
Aye.
Anybody abstain? Anybody no? Okay, we'll move that to the full legislature. Okay, I have a motion to adjourn.
So moved.
Seconded. Dan, those in favor?
Aye.
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 End of economic development planning, 6:07 p.m. You all very
Dan,
much.
you're up.
Okay, this is Physical Services Committee. Open for discussion. Any discussion? Hearing none. I'm going to go to the first resolution. Need a resolution assigning litigation to the county attorney for the sanitary district.
I'll sponsor.
Mike Pep and Brian second it. Any further discussion?
Yes.
All those in favor of moving it to a full
Yeah,
board?
Dan,
Yes,
I would like to ask a question.
go ahead.
Counselor, you're on the phone, right?
Yes, I am.
Megan, thank you. I just wanted to ask you, that financial impact comment left me yearning for more. How and why would it result as a savings to the county? Just a Cliff Notes version.
Just in short, we're not anticipating much more to happen on this litigation, but there are some loose ends we need to tie up as long as there's no appeal. But if this does move forward and if there is an appeal and if we do have to continue to litigate this, this will be completely run by my office, which means there won't be any more additional bills.
Thank you. Thank you for the clarification.
Any other discussion? All those in favor of moving it to a full board, say aye.
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 Abstain, opposed? So moved. Next resolution authorizing the county exec for intermunicipal agreement between the Village of Canajoharie wastewater treatment plant and Montgomery County Sanitary District 1 sludge treatment disposal. Do I have a sponsor?
Martin sponsors.
Martin sponsors, okay. And do I have a second?
I'll second.
I'll second.
Ryan Sweet. Any other further discussion on that? All those in favor of moving it to a full board meeting, say aye.
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 Any opposed or abstain? So moved. Anything under other?
Make a motion to adjourn.
Do I have
I'll
a
second that.
John
Okay.
Terry, you're up.
Okay. Meeting adjourned. All right, who's up next?
Right on time.
John Terry.
We'll call Health and Human Services Committee to order at 6:10 p.m. Do you have any discussion from the committee? Any discussion from anybody not on the committee?
This is Sarah Barenko. I just want to address all of my resolutions at one time because they all really work together. So the first one would be the resolution changing the Brown's Transportation. We had been working with Brown's Transport, which had sold out to the Student Transportation of America since the beginning of September school year. However, we were informed back in February that we could no longer maintain a contract with them as Brown's, that they had fully absorbed as STA, and so all paperwork, all checks, all contracts needed to reflect the STA corporation. So that addresses number one. Number three, establishing the LPN position for our COVID tracing and tracking guidelines and amending the budget. We had an open position for a community health nurse, which has been open for about a year, and we were struggling to find a RN that wanted to work in the county under this capacity. Now, with what is happening with COVID, we are being asked to look at folks who may have a capacity or some expertise and training in tracing. And they've loosened those regulations and guidelines a little bit as to who we can hire as full-time folks. Hopeful that with this establishment of an LPN position, we will be able to maintain this lower salary. It's a different, so it'll be some cost savings on one end. We will also be able to maintain this because it's already a part of our budget going forward and our state aid. And then finally, my last resolution, it's basically we just got some more money from OASIS for program increases. The gave us an additional $10,000 for those two programs. It's no cost to the county. It gets paid directly to the agency that it is allotted to. It came through and gave some COLA grants and some awards at a program and some computer equipment. So those are already allocated per state funding.
Thank you, Sarah.
You're welcome.
Anybody else for discussion prior to going into the resolutions? Hearing none. First up is a resolution to assign transport contract from Brown's Transportation to Student Transportation of America. Do we have a sponsor?
I'll sponsor. Hertel.
And Wilson. Discussion on that resolution. All in favor of sending it to the full board, say aye.
Aye.
Opposed? Abstained? It is moved. Next up is a resolution establishing an LPN position for COVID-19 tracing and tracking guidelines and amending the 2020 operating budget. We have a sponsor.
Number seven.
Number
Mike
five.
Pepp.
Number 5.
Got that, Cheryl?
Yeah, Pep and Wilson.
Okay. Discussion. Sarah, are you still on the line?
Yes, sir, I am.
Just out of curiosity, could you have any idea of comparison with your department versus our surrounding counties? Are you somewhat staffed similarly, staffed more, staffed less? Is that any information that you would know?
Yes, absolutely. So right now I am only down one position, and it is this open position. I know there are other counties in our Mohawk Valley who are down one or more positions. I think I'm very fortunate. I was not asked to furlough or lay off any of my employees because of the pandemic, but I know there is another county who is on our county call every week who they had to lay off 3 of their staff in the department. So mostly clerical staff. Our public health departments are not being asked, obviously, to lay off nurses or service coordinators, but they're really taking a look at clerical staff. I know that Schenectady County, the director there, she is struggling to fill nursing positions for people who have left, and our environmental department out of Schenectady, I know she's also looking to hire some folks in the environmental because there are a number of programs that still need to be running. But it's very difficult. So counties are typically not hiring in these pandemics because we're all looking to save money. But I think with our nursing staff and this just being a nursing position, we're very fortunate it's already budgeted. And, you know, it's needed. And the fact that we have the capacity to really look at filling in a gap and to alleviate some of the overtime that I probably will have to pay on the other end because of the nurses that are here working 7 days a week until 7, 8 o'clock at night. This will hopefully offset and take some of the work off of them. So the overtime will hopefully be a little bit less once we have somebody up and running. I know there is Hamilton County. I believe they are also down a staff person, but it's across the board. Health departments just don't have enough staff at this point.
Is this going to give you the capability to fulfill your tracing and tracking obligations that the state's put forth?
It will, because I have been saying all along, so COVID is happening, but so is rabies and Lyme disease and STDs and babies being born and lead. We are still functioning as a full public health department. We still have lead reports that are coming in from Albany Medical, for example. We have 2 children right now who are hospitalized at Albany Medical because they have lead levels of 55. That is unacceptable, that we just don't have the capacity to do the education with our community that we were doing before COVID hit. We have an emergency preparedness program. We still have deliverables that have to be met. We still have people who are letting their dogs loose and they're biting people, right? We still have a whole rabies program. Babies are being born. I talked to the folks at St. Mary's. The labor and delivery unit at St. Mary's is full right now. They have 14 beds, and there are 14 women in the hospital right now who have had a baby. And those are folks, we will get their baby referrals, and we can't, because of the restrictions on home visiting and some of the limitations that are being placed on public health, go out and do that education because we are doing tracking and tracing. And we have to remember, we only have 8 active cases right now, which doesn't sound like a lot. For every 1 active case, there's about 6 people linked to that one person. And in some of the cases, there's more than 6 people linked to that one person. So having an extra body as a nurse to do some of that tracing for us will not only help us now, but as we move out of COVID and we look at things like sexually transmitted diseases, as we look at Lyme disease, as we look at foodborne illnesses, this person will come in as a COVID tracer, but he or she will have the capacity to then learn the basic knowledge to trace and oversee and monitor the other illnesses and diseases that we do minus COVID.
Okay, thank you, Sarah.
You're welcome.
Further discussion?
I think Matt has a question.
Yeah, John, real quick, just to give you some perspective on the call today, we were talking about tracing. We're doing well in the region as far as meeting our numbers, but we have 6 tracers right now. This will make 7. But just to put it in perspective, Otsego County, relatively similar county, they have about 16 tracers. And I just bring that up because, both in Fulton and Montgomery counties, I think it's similar amounts of numbers of tracers. They've been working round the clock, and this is going to give them a little extra help as we go through this. So just a little perspective there on what other counties have versus what we have.
Thank you, Matt.
Yep.
And the position is 100% state aid reimbursable. So in the years past, we have not been able to meet our $500,000 cap reimbursement from state aid because we have always historically been down one position in a department. But if we are able to do this, we have the ability to charge this salary to state aid, and then the only thing that would be a county cost would be the fringe and the benefits. But at least the salary portion would be covered, and it's in our budget anyway, year after year.
Okay, thank you.
You're welcome.
Further discussion? Hearing none, desire of the committee? Move it to the full board?
Aye.
Aye.
Opposed? Abstained? It's moved. Next up is a resolution amending the 2020 operating budget for mental health. Do we have a sponsor?
I'll sponsor it.
Martin will second.
Dan and Martin. Discussion? Hearing none. All in favor to move it to the full board?
Aye.
Aye.
Opposed? Did I hear an opposition?
Nope.
Okay. Abstain? Motion to adjourn?
I have something else under other.
Yeah.
Okay,
I want to
go
ask
ahead.
a question too. Go ahead.
I've had a lot of questions on where people can get tested within my district, and I'm unsure as to where they can get tested. Do we have mobile sites? Are they only able to go to a hospital to get tested? Where can people get tested?
Absolutely. So we actually just obtained a batch of test kits from the State Department of Health that are to be used at our discretion. So typically what has been happening, we have been getting batches and they've been assigned to specific locations, like the nursing home initiative for residents and the nursing home initiative for staff. So we recently just got back a batch of 50 test kits that we were told we can do whatever we want with them. And our plan is to open that up for community-based testing at our pavilion up at Memorial Campus on Route 30. So if people are interested in getting tested for COVID, they can certainly call our office, the 3531 number. They'll do a health screening over the phone with one of our nurses. They'll take some basic historical history information on their health status, any exposure rate, any signs and symptomology that they've been experiencing, and then the nurse will talk them through the process of where to go. Our nurses make the appointment for our residents. So we actually make this very seamless for our residents. We get the information, we make the appointment, we call the patient back, give them the information, give them all of the paperwork that they're going to need for their quarantine, for the process, what it's going to look like. They go to the center up on Route 30 in Amsterdam. They receive the nasal swab. They're out of there in about 5 to 10 minutes, and then they're on their way. And then we monitor them every single day for signs, symptoms, temperature, fever, chills, until their test results come back. If they're an essential healthcare worker, they can go back to work after they've tested negative. However, if they are not an essential worker, there are some different guidelines depending on their exposure and the date of their test. So most of our people are staying on a mandatory 14-day quarantine, but we do have essential workers that are returning to work once they get a negative test result.
I'm not sure if we should go in an executive session or what, but I have a question on to number of cases versus number of cases surrounding counties.
Sure. So I can tell you that everybody has been asking me about why our numbers are so different than the New York State database. And I actually just put together a bullet point. So if you can give me 1 second, I'm just going to turn my chair around and grab my presentation.
While you're grabbing that, Sarah.
Yep.
While you're grabbing that, Sarah, I was just wondering why are our numbers less than other counties that are less populated?
Yep. That's a great question, Martin. I know it's because since Super Bowl Sunday, when I got the phone call that this was coming to New York, we have been extremely, extremely proactive in doing a number of things to keep our community safe. So the first thing we did was we started distributing PPE to our nursing homes. So when we start talking about the state coming in all of a sudden in the middle of May and saying that we need to focus on our nursing homes, Rick Sager and I delivered our first shipment of PPE equipment on a Saturday morning, March 21st, to all of our nursing homes. We've been getting PPE equipment, hand sanitizer, gowns, gloves to all of our nursing homes, all of our emergency medical responders. Rick and Jeff Kazar have been delivering gloves and hand sanitizer, masks since March. So we took a proactive approach because we understand here in Montgomery County that prevention is better than treatment. And I worked really hard to prevent an outbreak in this county. My staff and I have been working literally 24 hours a day since March 15th when we shut the county down. And that's because of the team that I have getting PPE equipment in. We bought test kits, as you know, out of our COVID funding instead of using that on other overtime expenses or overhead or admin costs. We spent $22,000 on testing, and we've been able to test 1,531 residents in our county to date, plus 541 residents in our nursing homes and staff. So this, the fact that we look different than other counties around us, I don't know what other counties are doing because I don't get involved in other counties, but I know here we started on March 15th, putting plans in place. My biggest fear was an outbreak at a nursing home. My second one was my jail, and the third one was my ARC, right? And so we started with those places where we knew there was a propensity to have a high risk and a high population outbreak. And we just hit the ground running, and we haven't stopped. We continue to deliver PPE and hand sanitizer, gowns, gloves, a number of resources to our nursing homes, and we do rotating testing for our nursing home residents. So we've already administered the 541, and we have another batch of tests that just went out to our nursing homes, to the staff and the residents. It was 1,080 that were given to the emergency management department that we then turned around and gave to our nursing homes and to our Liberty ARC for testing high-risk populations. And I think the other part of this is I think people in this community respect us. They respect Jeff Smith. They respect Jeff Kazar and Rick Sager, and they listen to the county executive when he asks and begs that we keep our elderly safe. The other thing we've been doing is we've been getting public information out. We do a Facebook Live video every Friday. We send out social media blasts. I'm on the radio every Friday for 2.5 hours answering community questions. We're setting town halls. I've been assigned to Congressman Delgado's Health Advisory Committee. I also received a phone call, and I'm going to toot my own horn here, from a county much south from here, telling me that NICEHO, which is our Director of Public Health Conference, told him to call me because Montgomery County is being looked at as a model health department for what we are doing. And so I'm very proud of that. And we have been able to keep our numbers low because of what we started back in March.
Sarah, I'm proud of that too. Nice work.
Thank
Great
you.
work.
Great
Good job, Sarah. Good job.
Thank you.
Anything else?
So Martin, also to answer your question about data, so I just wanted to clear this up. So I know the state website says that we have like 72 or 73 people. We actually got that list of people that the state has that they're reporting on. And what we found out today, looking through those names of who they have as positive, that number has 2 people on there that are the same. So there are 2 people who were counted twice. So that adds 4 to that state number. And then we also found that one of those people that is on the list that the state has as a part of our 70, this gentleman went to 4 different test sites on the same day and was administered 4 COVID tests. He went to 4 different counties and got 4 tests on the same day. So now he counts as 4. So when we're looking at our data, we have to clean up the data that the state gives. So that number on the website that the state is posting, our data is more accurate because we have the capacity to go in and clean up that data and look and say, why is, John Doe on here 4 times? He's only 1 positive case. He's not 4 positive cases.
I'm sorry, Sarah. I know that you're doing a wonderful job and we're doing a wonderful job in Montgomery County. I'm just wondering, where can I tell my constituents who want to be tested, where can they go and get a test?
They can call our health department and we will arrange for the appointment to get them up to the Rao Pavilion to get them tested.
Hey, and Martin, also, for your constituents in the western part of the county, that Utica might be a better option than Amsterdam. Griffiths Air Force Base is doing free testing. You drive in, you get tested, you're there for 10 minutes, and you're gone. I can send you information about that. That might be another option for folks in the western part of the county.
That would be greatly appreciated.
You got it. We'll send you over that info. And there also is an interactive map on the state website that shows all the testing sites, because they're starting to pop up at, there's a Walmart one in Fulton County, I believe, and you're going to start seeing more of those things. So as we get that information, we'll send it out to you.
Sarah, this is Legislator Cap. I just want to ask you a quick question. I know you've been putting in a lot of long days, including today. I just was wondering, when we get around to talking about a report we have under my committee regarding potential 20% reductions from the state, if you'd be available in case we need to talk with you about that.
Absolutely. Is that tonight, Legislator Pep? That's later on the
Yes.
agenda?
It'll probably be the last thing we get to, actually. Yes.
Okay, sure.
Or if you want to dial back in, feed your kids and dial back in or whatever.
Oh, nope, that's okay.
Okay, thanks.
You're welcome.
Anything else from anybody?
Motion to adjourn.
I'll
We have a
second it.
second? All in favor?
Aye.
Aye. Aye.
We are adjourned.
Okay, I'll call the Education and Government Committee to order. It's 6:31. Any discussion from the floor?
I think you're at, hold on, it's, I think I'm
We
next.
need public safety first.
All right, you ready? We're going to call the Public Safety Committee to order at 6:32. First thing on the agenda is discussion from any of the members, legislators, anything to discuss. Hearing none, we'll move right on to the resolutions. First resolution is a resolution amending the 2020 operating budget, accepting an additional Stop DWI Crackdown Enforcement Award. Any
Martin will sponsor.
Martin, second.
Pertel will second.
Pertel. Discussion?
Yes, sir.
Hearing no discussion. All those in favor?
Aye.
Aye.
Opposed? Abstain? So carried. Next resolution is a resolution authorizing county executive to sign New York State Indigent Legal Services Grant statewide hiring second year for the public defender. I need a sponsor.
I'll sponsor.
Say it again.
Martin will sponsor.
Number
Four
1 and
seconds.
number 7.
Headwell and Martin.
Oh, it's Pep and Martin. Pep.
Okay.
Any discussion? Hearing none, all those in favor? Aye.
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 Opposed? Abstain? So carried. Next resolution is a resolution amending the 2020 operating budget and authorizing county executive to sign New York State Indigent Legal Services Contract Distribution 10. I'll sponsor. I need a second.
I'll second.
Dan Wilson, second. Discussion? All those in favor?
Aye.
Aye.
Opposed? Abstain? So carried. Next resolution is a resolution amending the 2020 operating budget with forfeiture monies. District Attorney. I need a sponsor.
I'll sponsor. Pertel.
Pertel and Fair. Discussion?
Who was second?
Fair.
Thank you.
Is there any discussion on this resolution?
Move it.
All in favor?
Aye.
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 Opposed? Abstain? So carried. And the last resolution is a resolution amending the 2020 operating budget, Sam Grant Emergency Management. I'll sponsor. I need a second.
7.
4.
Number 7. We got an email today from Rick explaining what that is. Rick, if you want to just touch on that quick so everyone knows exactly what that is.
Okay, back in 2017, then Director Jeff Smith, our current sheriff, got the grant to put the standby generator at the Oppenheim Euphrates St. Johnsville High School located in St. Johnsville, in hope that we could bring this up to the standard that would be needed to utilize that facility as an emergency shelter. Timing of the grant came very fortunately that it fell in line with the capital project being done at the high school. So while they were doing interior work, it made it very easy for the electricians to run the necessary conduit and wiring, install the breaker panels and the switch boxes, along with work going on outside. They incorporated the siting of the propane tank that will fuel the generator. The slab is already there. The last piece that we're waiting on, which was kind of stalled due to the COVID-19 situation, was the purchase of the generator and placing it on the slab. We hope to have that done by anticipated beginning of the school year in September.
Okay. Thank you. Anyone else? Any questions for Rick on this resolution or any other discussion? If not, all is in favor?
Aye.
Aye. Opposed? Abstained? So carried. Anything else under other? Need a motion to adjourn? Motion?
7.
7 motion. Second?
9.
9. We are adjourned.
Okay, we'll call the Education and Government Committee meeting to order, 6:37. Any discussion from the floor? Okay. The resolution adopting introductory local law B of 2020, a local law amending section 7.03 and section 7.04 of the Montgomery County Charter, local law number 2 of 2012. Do I have a sponsor?
7.
1.
Do we have any discussion?
Okay, who sponsored?
7.
3. 9.
Sounds like an auction.
3.
But now on, we got to do hand
F and
language.
J here. Okay.
Okay. Any discussion on this? Hearing none, all in favor to send it to the full board?
Aye.
Aye.
Opposed? Abstain? Next resolution adopting introductory law C, local law 2 of 2020, a local law establishing a fee for envelopes. Matt, you want to speak on this, or is Brittany on the line?
I'm here.
Brittany is.
Brittany?
Yep, can you hear me?
Yep, go ahead.
Yeah, so we just have come across so many times in our clerk's office that people are supposed to be sending us self-addressed, self-stamped envelopes to mail their documents back. And, you know, more times than I can count, people forget. And then essentially what it does is it just causes a great inconvenience for the people that are, you know, using our office, because then we have to wait for them to then send us a self-addressed, self-stamped envelope. It makes everything twice as long. And we just thought, you know, if we could just charge them. A lot of these people have accounts in our office that they pay on a monthly basis. So we just figured if we could just, you know, charge them $1 for the envelope, it would save everyone a lot of time and headache.
Okay. Can I get a sponsor for this?
5.
A second?
And by the way, just so you guys know, the dollar fee does include the postage.
Any other discussion on this, folks?
Have a discussion. $1.
that?
How do we come to the $1 fee? Because sometimes these envelopes, I would assume, are more than general mail of 55 cents.
What was that, Martin? I'm sorry.
I assume that some of these envelopes that we're mailing out cost more than the 55 cents to mail out. So I think, how did we
So
come up with $1?
So this $1 fee only applies to the number 10, white standard envelope. So anything that doesn't fit in there, which I believe is 5 pages, it goes over the weight. So anything over 5 pages would have to go into like a, manila envelope, and that's a whole different story. This is just for the white number 10 standard business envelope.
Any reason we couldn't do $2?
Well, I had discussed it with our county attorney, and we didn't want to run the risk of overcharging for something like this because it could be seen as an unfair tax.
It is an unfair tax, but people should be submitting self-addressed stamped envelopes.
Well, Martin, that is true. They should be doing it, but unfortunately, a lot of people forget to do it. And so just in the, in the spirit of efficiency and, trying to get a lot of these documents are very time sensitive. And so in the spirit of efficiency and then thinking about the time sensitive nature of a lot of these documents, we thought that this would be a great option for them so that, it doesn't extend the process longer than it should be. If I can just say a word, and anytime a county is establishing a fee, it has to, by law, be rationally related to whatever service or whatever is being provided. The fee has to be rationally related. So the county clerk actually did quite a lot of research on this to make sure that that the fee that she was recommending was something that we would be able to hold up or defend if there was ever a question about it.
Thank you, Megan. Any other discussion?
So are we equating our people's time to 45 cents to print the envelope, get the envelope out and everything?
Right, and the cost of the actual envelope.
So if you divide $15 an hour, which I hope we're not paying, we might be. $15 an hour divided by 60 comes up to 25 cents a minute. But it just seems that, I think we should at least be charging $1.50 to $2 for this.
This is a fee that I had, worked in conjunction with Megan about and establishing this fee. I was reticent to make it more than $1 because, I just didn't want that sort of unfair tax sort of following me around. But, I'm sure that it's something that, we could always change.
I'm not on the committee, but I was an amendment to change it to $2.
So who is, Brittany, who is at the disadvantage if envelope isn't sent to you? Is it the county that's at the disadvantage, or is it the person waiting for their document?
It's the person waiting for their documents, really.
So,
because like I said, a lot of them are time sensitive, right? They have to do with mortgages and deeds and people trying to close court cases and things of that nature. So a lot of times they want these documents right away.
Well, that's, I don't know how that's the county's responsibility to babysit people who forgot to send their envelope in. I'm assuming once or twice that they have a delayed, having their paperwork delayed, they'll remember to give you their envelope.
Right. I think we kind of looked at it as, we're providing another service. We're making things easier for people. And, while we're making it easier for people, they're going to have to pay for it.
Yeah, I don't have a problem with the $1 fee, but I don't know.
How many envelopes are we talking about a year?
That I can't give you a number on how many per year. I can tell you that it happens often.
500?
Mr. Chairman, I think there's been adequate research done here as a small solution to the problem. I think it's time to vote on this.
I agree.
Okay.
I propose an amendment.
I'm not sure there was an amendment passed. There was?
Yes.
No, there
I
was
made
no
an
amendment.
Change it from $1 to $2.
Who wants to put the amendment up?
Martin,
I'll second
So-
that.
Okay, so the amendment of changing the fee from $1 to $2. All in favor of the, or is there any more discussion on the amendment? So the committee, all in favor of going to $2? All in favor?
Aye.
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 the committee is Legislator Headwell, Legislator Thayer, Legislator Wilson, Legislator Duchessis, and Legislator Pep.
Okay,
I'd like to vote no if given the opportunity.
who's that?
6, Duchessis.
Duchessis.
Okay, I vote
Number-
no.
Number 3 also votes no.
Wilson
The
and
amendment
Pep.
does not pass.
So going back to the resolution as it was submitted by Brittany, all in favor?
Aye.
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 Opposed? Some extensions? Okay. You all set, Cheryl?
Yes.
Okay. Resolution adopted introductory law D, local law 3 of 2020, a local law establishing a fee when recording conveyances. County clerk, do I have a sponsor?
7.
Second?
3.
Brittany, want to, discussion?
Sure.
Brittany?
Sure. So, a law was passed in New York State Legislature requiring county clerk's offices to notify previous owners every time a mortgage is filed in the office, alerting the previous owner that somebody, well, actually, I should say alerting the owner of record that somebody has submitted documents to produce a new deed and to take ownership of that property, because my understanding was there was a lot of fraud going on, mostly down in New York City. The County Clerks Association got together at their winter conference back in January and collectively decided as an association that a $10 fee was sufficient with the work that's going to be involved in sending these letters out constantly. We file about 1,800 deeds a year in Montgomery County. In the state law that was passed requiring us to notify them, there was mentioned in the law that the county clerk's office could establish a fee that was reasonable in order to send out these notices.
Any other discussion? All in favor of sending it to full board?
Aye.
Aye.
Aye. Opposed? Abstain? Okay, next resolution amending the 2020 operating budget, COVID-19 related election charges. We need a sponsor.
5.
Second.
7.
3.
Okay. On discussion, Terry?
Chair?
Gary, you're
Yes,
Was it
this is Terry Beniak, yes.
You want to discuss?
Yeah, I believe the resolution that you're talking about is we're receiving a COVID grant from the state. So the way it works is actually we have to, the legislators have to put the money in our budget first, and then when the money is spent, then we get reimbursement from the state.
Any other discussion on this?
I have a question.
Go ahead.
Yes.
Number one, legislator one. Is this for the mail out ballots for the primary?
We can use it for mailing all the absentees and the postage that's involved. We can also use it for cleaning the poll sites. We can also use it for paying the poll workers if we needed more staff. So really, it'll pay for whatever's involved for the June primary.
So how is the June primary going to work? Is it all by mail? Are the polling sites open? How is this working?
Well, we're going to do both. Actually, a voter has three options. They can either do an absentee, they can vote at the poll site, or they can do the early voting.
I have no other question.
Any other discussion on this? All in favor of sending it to full board?
Aye.
Aye. Opposed? Abstain? Okay, the last resolution amending agreements with New York State Industries for Disabled Incorporated and General Code for the 2019-2020 Digitalization Grant Project. Have a sponsor?
I'll sponsor. Pertel.
Second?
The voter has three options.
Yep, 7.
Either do an absentee,
Any discussion on this? All in favor of sending it to full board?
Aye.
Aye.
Opposed? Abstain? Anything under
Madwell?
other?
I believe you missed a resolution.
I thought so.
Sponsored resolution. The resolution amending agreements with New York State Industries for Disability, Inc. and the General Code for 2019-2020 Digitization Grant Project Extension.
You missed the
did that.
resolution amending the
did that.
2020 operating budget for Board of
I think he
Elections.
skipped a resolution before the one that was just read.
Correct.
He went one resolution ahead. He has to back up.
What resolution was missed?
It's resolution amending the 2020 operating budget for elections.
We did that one. That's what
Board of
Karen Beniak
Elections.
just talked.
No, that was the first one.
Yeah, that was for COVID. This is the $34,000 one.
I don't have that one on my list, Cheryl.
Yeah, I don't either.
I do.
You are correct. It is in the packet, but it is not on the agenda.
Okay, yeah.
I've got it on mine.
I don't have it on mine.
Nor
Would
do
you
I.
like me to read the title of it? You do have the agenda or the resolution in the packet. It's just not on the cover page.
Okay, let me go down and find it then, Cheryl.
There will sponsor.
I sponsored.
Resolution amending the 2020 operating budget Board of Elections. The sponsor?
Air.
Second?
Pertel.
Okay, any discussion on this? All in favor of sending it to full board?
Aye.
Aye.
Opposed? Abstain? Okay, anything under other?
Motion to adjourn.
You
Motion
still
to
have that.
adjourn?
You didn't do
Second.
the last resolution.
What one?
Resolution amending agreement with New York State Industries.
We did that one.
We did that one.
That one was read out of order. That's why we went back and filled the one that we missed. Maybe looking
Voted on
at
that one?
a different sequence, but we voted on everything here now.
Oh, I didn't realize you voted on that.
Yep. Oh. So we have a
Sponsor
motion to
was-
adjourn, a second?
Second.
Okay.
All right, I'd like to call the Budget and Finance Committee meeting to order at 6:55. Remind that this is a committee of the whole. We're all voting members. Any items for discussion? Other than
Number
what
one
we're.
has a question.
Yes, sir.
I'd like to know if the treasurer can get us information on how far below we are on sales tax and fuel, our tax base, you know, the ancillaries, compared to today from previous year.
Through today, that's not on our dashboard in front of us that we're going to go over?
I want to know a year to date. Where does he project us at, knowing that we're 6 months behind? And
Well, can we get into talking about that during the dashboard and let him expound on it? Because I have some data of that nature through the end of April anyway. And if he wants to expound on it from there, if that's okay with you, Legislator Martin. Martin? Oh.
With me.
Okay, thank you. All right, our first and only resolution is a resolution approving the abstract of audited claims.
Number 4.
Number 4, do I have a second? Number 5.
3.
Any discussion? Hearing none. All in favor?
Aye.
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 Opposed?
Aye.
Abstentions? All right, thank you. I'd like to start off the reports with the our annual financial report update document, which our treasurer did file on time by the April 30th deadline. And as has been our general approach to this document, I'd like to just direct your attention to two pages regarding our fund balance, and certainly open up to any other questions beyond that. Turn to page 4, please, or scroll yourself to page 4. We look at the annual comparison, year-over-year comparison of fund balance and the division of it between assigned and unassigned for 2018 and 2019. I'd like you to take a look at the year-end 18. Our unassigned fund balance was actually the combination of the $4,881,000 that you see down towards the bottom, the unassigned fund balance, plus the $758,000, which is called the non-spendable fund balance. Now, if you looked at the 18 odd, there would have been a zero value in that non-spendable fund balance. But they put that figure in this category to show comparison for 2019, because it does exist as of our 4/30/19 odd. So our unassigned fund balance is the combination of those two figures as of the end of April of 18 or of 19 was about 5.6 million. And if you add two figures together for the end of 19, the 5,980, the 5,980,000, and the 758, it shows an unassigned fund balance of 6.7 million. So our fund balance our unassigned fund balance actually grew. Now, ask what's non-spendable fund balance. Of course, I got clarification on that from Sean. And what it is it's related to advances of capital projects that are subject to reimbursement. And because we had some capital projects going on at the end of 19, the state reclassified $758,000 of our unassigned fund balance to this unspendable fund balance. But it will be money that we do receive once these capital projects are done. Looking at the 2 year ends, the fund balance has essentially grown from 5.6 million to 6.7 million. Also, during my review of this document Friday with Sean, he brought to my attention, and I'll bring it to your attention, that since this audit was done, the Bonadeo Group has been in doing some of the field work toward our 1231 financial statement completion. And they found another $838,000 worth of positive adjustments. Those $838,000 of positive adjustments to our unassigned fund balance consisted of $1.3 million in mental health revenues and a detraction of $500,000 from the Beech Nut pilot program. And Sean can expand on that, but essentially we overestimated how much money we were going to get from the pilot in our 2019 budget, having to, and it has to do with money that has to go elsewhere from Beech Nut and not into our coffers.
Are you on, Chair?
I'm sorry?
What page are you on?
I am on page 4. Looking at the bottom of the fund balance reconcilement. So we essentially have, since this audit has been done, we have another $838,000 coming into our unassigned fund balance as of our 12/31/19 statement when we get it in the fall. So really, our unassigned fund balance, given those new Bonadeo adjustments that happened since the audit, has grown from 6.7 million to 7.5 million. So, you know, we had a good year last year where our sales tax came in way higher than budget. That helps offset not using a lot of fund balance. But I will also direct your attention to page 13.
Chair, can we just go, Chair, just before you get too much farther?
Yes, sir.
$800,000 actually received, or is that just on the books waiting to be received from either state or federal?
John?
It's actually received money.
You passed the
received
entry already, correct? Okay.
Correct.
Thank you.
Because the way the mental health revenues work is everything's in advance, and I have to book it once the expenses happen.
All right, thank you.
So I guess the good news is our fund balance grew from year-end 12/31/18 to 12/31/19. And it's grown even more since Bonadeo's been in our shop since the completion of this audit. Now, go to page 13. It's a short page. You look at the top of the page. And if you look at the reconcilement of the analysis of changes in the fund balance, you see that last year, the total fund balance ended up at $10,505,000. Start off with in 2019. And then you see the $1,086,000 value there. That was the Bonadeo adjustment last year when they came in and scrubbed our DSS. And remember, they really cleaned up all those receivables. And that was the jolt we got like last August, September, when Bonadeo was done with their review. That's what that figure is. So that adds up down, you see at the bottom of that column, to $10,577,000 of total fund balance. Now we can add the 838 to that as well, which will grow it to 11,415,000 roughly. So, and I'm certainly not trying to confuse you at all, but if you go, keep in mind now that fund balance is 11,415,000. If you go back to page 4 and you subtract out the assigned appropriated fund balance and the restricted fund balance from that 11,415,000, the assigned fund balance of 3,213,000, and the restricted fund balance 624, almost 625,000. You subtract those off the 11,415,000, and it comes down to 7.5 million, just to show you how it foots, you know, from one page to the other. So both of these pages now when we add in that extra $838,000, lead us to an unassigned fund balance of $7.5 million as of 12/31, 15 or 19. And we will see that on our statement when we get it in the fall. With that, I'll stop if there's any other questions.
Chair?
Yes, sir.
Being that we're in the district to open up and such, is Dio willing to come out to our July meeting, which I assume we'll have in person, or our June meeting, to go over the AUD?
Can we ask them to do that the next time we're able to meet?
Actually, Bonadio will come out, like I said, Bonadio doesn't actually do the AUD. That's something that I do as treasurer. They will come out when they complete their audited numbers. And that'll probably be around September, October. They don't do an audit of the AUD before they do the audit of their total financials of the county.
So then will the treasurer come to our June meeting to go over the AUD?
Yes, I'll be there.
Legislator Kelly, we may be meeting in person again in June. Is it something you want to do while we're all together in the same room? Is that your goal?
Yes, because some people aren't able to pull it up on their computers and such. I think it would be a good thing for people to actually have the document, be able to pour over the document and answer questions.
Okay. All right. Then we certainly can arrange for that to take a look at it. Absolutely. But I mean, I guess the Cliff Notes version is
our fund balance grew unexpectedly.
Well, I don't want to say unexpectedly. I think it's a function of some wise budgeting. You know, when we budget low on sales tax and we collect far more than we budget, it has a net effect on us using less of it. Plus the combination of having those adjusting entries from Bonadio last year when they cleaned out all the DSS receivables. The combination of those two events, in my estimation, were the largest contributors to the growth of the fund balance. So, and I think that's what you'll see when we have a chance to look at it, when everybody has their copy in front of them.
Chairman, Mike?
Yes.
What was the fund balance in 17? Do you know?
I don't have that in front of me.
So what was it for 2018?
Well, the unassigned fund balance at the end of 18 was 5.6 million on our audit last year.
And what was it for 2019?
It's 6.7 million. And the reason it was 5.6 million as of our audit last year is because we still had that large collection of receivables that had not been come in from the claims through the claims hadn't been processed in DSS. So, I mean, once we got word of that in August, and we knew that we were going to have a positive adjustment to it, it came out, you know, it's gonna come out on our 12/31/19 statement. Remember, this is a snapshot in time, this audit, as of 4/30, 19. So that didn't take that into account at that time.
Mike, excuse me, Mike.
Yes, Bob.
This close to $1 million, is that just for 2019, or is there from previous years adjustments that we picked up also? And do we anticipate difference this year than what we budgeted?
Well, I will say what I think it is. I think a lot of those DSS adjustments, a lot of it were for 18. Some of it went back into 17 and 16, though. Sean, you want to expand on that? Sean? His mic's on. Sean? Maybe he's in the bathroom.
So it probably was extended over 3 years or so.
Yeah. Yeah, I mean, we had some, the bulk of those claims that they reconciled out last August.
Yeah,
were for
the adjusted fund balance was legislative.
Sean, Legislator Patel's question was the $1,086,000 in adjustments for DSS last year, once bond deal came through. How much of that was for the previous year, 18? How much of it was for years before that? You know, any idea? The bulk of it was for 18, wasn't it?
The bulk was 18. I don't have a breakdown here with me at home of what was prior to 18, but that was all 18 and prior. None of that money is 19.
Right. All right. Any other questions on this based on what we just spoke about? Or any other questions? Hearing none, I'll move over to the dashboard reports and try and get through them quickly here, which shouldn't be difficult. If you look at the general fund, our sales tax revenue through February was $775,000 greater year over year. Because remember, this is April 30th and it's a 60-day lag. So the numbers we're looking at sales tax are through the month of February. So, I mean, obviously we know what's going to come. The storm's going to come next month when we look at this dashboard through the month of March when COVID hit and everything else. But the news was we were tracking $775,000 greater than 2019 year over year through February. Now,
Pre-COVID.
Pre-COVID, yes.
Yes, and pre the decline in gasoline prices.
Yeah, yes, pre everything, absolutely.
Yeah.
You know, now when I met with Sean to review the dashboard, he indicated to me that he got his May receipts to date, which is actually for sales tax through March, are down 29% from 2.4 million to 1.7 million. So right now we have a precursor to what we're going to see when we look at the dashboard at the end of May through the end of March. Our sales tax will probably be a wash because we gained $7.75 million, dollars through the first 2 months, but we lost it all pretty much through the month of March, or the lion's share of it, 700 to 750,000 of it. So we'll still probably look even with last year when we at the May dashboard, which will be through the end of March. Then it's really gonna, decline from there. But the other categories on the dashboard, obviously, we're 33% of the way through the year here. So any income category that is less than 28%, any expense category that's over 38% gets the red. The state DSS, you see that February submitted, Sean has indicated the March claims have been submitted. The April claims are submitted by the end of May. It's slowing down a bit. They aren't keeping up the pace that they were before COVID, largely, according to Sean, due to the fact that, some staffing reductions and, working remotely, they're not able to process them as quickly and as efficiently as they did before. But if we get our April claims in through the end of May, we'll virtually have been caught up there. So hopefully management can stay on top of that. The same would be for the federal aid as well. State aid other, you can see that is down. There's only been a few claims submitted, and that's most of that is reimbursable business. So when claims haven't been submitted, we haven't incurred the expenses as well. Departmental income, you can see is down, looking at about 25% there. The lion's share of that that line item is $6,900,000 for the annual budget. $4 million of that is refuse and garbage. And Sean has reported that through March, our garbage operation is about $12,000 ahead. So, the fee increases we implemented last July are continuing to carry us in the positive. And, another offsetting characteristic of this is although the revenue is below 33%, so is the expense. Because if you go down and look under home and community service on the dashboard, where the expenses related to our garbage operation are recognized, you can see that that's in the green. And, that's the general comment I guess I wanted to make here, was that as you look at these dashboards and just look at the colors, on the expense side of things, the only things that are red here are education, because of the same old reason we're used to, which is half of the yearly contribution to FM has already been paid, and that always puts us in the red. And then we pay the other half in the second half in July, and that doesn't catch up till the end of the year. And another one is transfers out. And transfers out there at 45%. And that's because money is transferred out of this account to pay for the snow contracts, which are already paid in half. So, I guess the theme I'm trying to get across here a little bit is that, expenses are running, under budget for the most part, except for areas where we have to make lump sum payments on things like the college and the snow contract. In the other categories, they're running below budget, which, is a positive thing at this particular point in time, obviously. Now I'm going to stop right there. And Sean, Martin asked that question about the sales tax at the beginning of this discussion period here. I know that last year we got, and I misquoted this in a text chain with all of you on Mother's Day, when I was in 30-car line waiting for my Mother's Day dinner at Rain Dancer, and I said we got $34 million last year. Well, we only got $33 million last year, but it was still well above budget. It was like $3 million over budget. So, but Sean, can you let Martin know, exactly, or any more detail on sales tax other than that I've described here today?
No, other than the initial projections at NISACs and what's materializing around the state is sales tax has been down somewhere in the range of 25 to 40% based on counties. So our first payment that represents the COVID month, which was the month of March, our sales tax revenue is down, like Mike said, 29%. Like I said, it's gonna be a month by month thing as far as how much the county's actually going to be impacted when it comes to sales tax.
And the NISAC reports, I know we've got flooded with emails all the time here regarding data that was happening. But if you paid any attention to them, and I have them here, originally they were predicting a mild scenario of a little over 1 million and a severe extreme one of a little over 3 million. And then they amended that about a week ago, and the mild scenario is about 2.7 million, and the harsh extreme hit would be about 6.7 million. So, and we'll talk about that a little bit more when we look at that 20% report there at the end of here. So, obviously, we're going to take a hit. There's no doubt about it, and it's going to be because of all the things we said. Retail's down, gas prices are down, gas consumption is down.
Sheriff?
So, yes.
Last year, the state implemented the internet sales tax or worked on that. Are we seeing any direction from anybody on that? I would assume that internet sales are up considerably. Do we know what to expect with that? Do we have any telltale signs of what is happening with that?
Sean, how much did we get in internet sales tax the first couple of months? You got that figure handy?
No, I don't have that handy, but what I can tell you is, because I just did get a report from NISAC, it's very difficult to pick out what's internet sales tax, because particularly those vendors that have brick and mortars, like your Walmarts and Targets, anything online is not reported differently from inline, or it's just reported under Walmart. So the only true internet tax you're going to see are your Amazons, and Amazon was collecting tax before. So really, the impact of the internet is not that great, but it's nowhere near going to cover the impact of what COVID has done.
Now, Sean, what was our budget figure for internet sales tax this year? You got to have that figure in your mind.
I believe we were estimated to get somewhere an additional 1.5 to 2, I believe.
Total.
But that was pre-COVID.
Right.
Yeah, Sean, can I get a copy of that report just so I see what it looks like, so I understand it better?
Yep, I can get that tomorrow when I get to the office.
Please, if you would, I'll be looking for it.
You send it to everybody.
Yeah, please.
Number one has a question.
Yes, number one.
On these dashboards that we're looking at, and I may have missed it because my computer froze, so I had to call in to get volume. This dashboard is April 31st. Sales tax is how many months behind?
Sales tax is 2 months behind.
It's always 60. We're always just looking at a 60-day lag when we're looking at these. So these are actual numbers through February.
February.
Yes, sir. And we're up.
Up until February, we were up.
Yep. And in the month of March, we're down about a little over 700,000 based on real-time receipts that Sean has seen come into his office this month, which would be all of March. Correct, Sean?
That's correct.
Okay. So Legislator Kelly, we're probably, like I was saying earlier, when we look at the May dashboard in June, which will be through March, probably going to look about even with last year by that point in time. And then it's going to start to decline, obviously. So
I understand that. Thank you.
You're welcome. All right, just, quickly looking at the other dashboards, nothing really monumental. CHIPS state aid is at 0 because Eric hasn't started the CHIPS projects yet. Transportation on the county road fund is up in the 59 percentile because we paid half the snow contracts already. Onto the road machinery fund, the interfund revenues are at 1%, and the use of the county's equipment. So as it gets used, it'll grow. And back down on the health insurance fund, the last dashboard, you see Sean's comments there. The intergovernmental charges that are tracking at 0 will be billed on a quarterly basis, and we'll see a dollar figure in there in the month of May, and other fringe benefits of FICA and workers' comp for funded employees transferred in full. So
number 7, Chair.
Yes.
I have another question.
Yes, sir.
I can't remember the last time. Maybe we did see it, but is there a report to bring us year to date? Because we have these monthly dashboards. Can we see a monthly dashboard where the year has closed out and see where we're at?
You mean the prior year?
Right. So if we
Yeah,
were
you
to
asked-
close out 2019, we
Yes.
we see the dashboard in December or January for December. We're not really fully closed out because the closeout
Correct.
hasn't happened. I'd
And
like to see where we're at, where we're red, where we're green on this dashboard when we fully close out.
Absolutely. And you know what, Legislator Kelly, you asked for that last year, and you know what we did? We delivered it. And we will do that again. We'll do that next month. Sean, can you do a year end 12/31/19?
Yep, I can have it done by the end of the week if you want it distributed before that.
Yeah, let's get it out to everybody, and we can talk about it, next month if we want to.
Okay, I'll send it to Cheryl by the end of the week.
Legislator Kelly brought that up last year, and it was a great observation, and it's time to do it again to look at 19. So
Now I'm not done. Don't stack that off. Number 7. I want to go back to the front page of the general fund.
okay,
I want to go to the DSS. I understand the county government is shut down, quote unquote. Did we meet our deliverables on reimbursement last year?
yes, all our claims and all our reconciliations were done. Correct, Sean?
That's correct.
Oh.
So how far behind are we this year?
You must have been offline when I was talking about this. Right now, we're the March, or excuse me, the April claims will be submitted by the end of this month. March have been submitted. So what we were trying to do was get the previous month done by the 20th of the next month. So, for the April claims to be done by the end of May is a little slow. They should be done by May 20th, by tomorrow. But, under the circumstances, I think we can grant them some slack.
Thank you.
You're welcome, sir. All right. On to our, which is the 20% report. And this was discussed among ourselves as brought up by Legislator Pertel, in a text chain this week as we've been communicating. So, when what Sean has compiled here is a report that shows all state reimbursed, Fed reimbursed, which is on the second page, last but not least, sales tax, and how things will be impacted by 20% reductions. Now, you guys, everybody's, yes.
Just for a minute, Mike. Do we anticipate a 20% reduction from the federal government as well as the state?
No, we don't, and Sean will explain that in a moment, but he put,
thank you.
In case, just for us to be the worst case scenario. Now, if you look at all these categories, all the categories on the front page, if you go to the top of the second page, would total 20% reduction in, all of these would result in a $2.948 million loss,
reduction,
so to speak. And if you break that number down a little bit, the vast majority of that number, as you can see on the front page, is a combination. If you add up everything in public health, starting with that 277 down to that 29,650, that's 464,000. Mental health, 711. Social services, 969. So those three categories comprise the lion's share of this state reimbursement money. Yeah, the public works up on the top of page 2. You can say if they cut chips 20%, well, we'll be out $484,000. But not a loss, if you ask me, and I've discussed this with Sean. We just don't
Do the work.
undertake the road projects, you know what I mean? So that one's not going to hurt us, directly. However, and that's why I wanted to keep Sarah on the line here. As we look at the selection of public health and mental health programs, combined, they're $1,175,000 if they're cut 25%. DSS, obviously. Those are types of services we get reimbursed from the state, where the show must go on. Our constituents need these services, whether we're getting the money or not. And so, Sarah, if you're still with us,
I am.
At least, and thank you for hanging on there, at least from the standpoint of public and mental health, can you give us some insight into these programs, excuse me, that we have listed here? Education, handicapped children, public health grants, early intervention, Medicaid, and then under mental health.
Yep, absolutely. I'll start with mental health because it's much simpler. So when we're looking at the mental health budget, what happens is we are just a conduit for pass-through dollars. The state chooses the providers that they wish to contract with. And our 9 providers are St. Mary's, HFM Prevention Council, Catholic Charities, the HFM Prevention Council, Capital District Respite, Captain's Resources, and ARC, Liberty ARC. So those are our 9 programs that the state has picked to be providers for mental health and substance abuse, as well as OPWDD services in Montgomery County. They decide how much state aid those agencies are going to receive based on how much revenue they produced the year before. So they have to obviously do Medicaid billing, they do private pay, they seek grants, and so on. So with the hospital, for example, we provide them about $2 million a year between substance abuse and mental health services in state aid. It comes of no revenue source of the county. We are just responsible for making sure that the agency that the money is given to, that they are using it appropriately. At this point, the state has loosened up some of the regulations, obviously, due to lack of in-person counseling services. They've implemented some telehealth practices, so they're really ramping up a number of their programs as a result of this. We have been made aware from OMH, OASIS, and OPWDD that at this point, state aid would not be cut for programming. It does not mean that state aid will not be cut for salary or, office supplies, things of that nature, extras. But as far as programming, funding will...
This is for mental health.
This is for mental health. Yep, it's easier. Okay. Mental health is much easier. It's very concise. So those funds will stay in place. They usually don't go up by much every year. If an agency applies for a new program, St. Mary's, for example, is applying for a new ambulatory detox extension on their program that they have currently on the 4th floor, but that probably won't be coming through us for the next 2 or 3 years. If that does happen, you may see a hard spike of $580,000 up to $880,000. That's what the grant is about. But that won't happen in this budget year. So mental health is pretty...
Can I stop you right? Let me stop you right there, if I would, please. I guess our fundamental question will be this. At least mine is. If we don't get the money, we don't incur the expense delivering the service?
Correct. We have a really phenomenal county attorney who put a clause in all of our contracts when I started in this position that was not there before. And the clause clearly states that if we do not receive state funds from the O agencies, that we will then not be responsible as the county to pay that. So if the state comes in tomorrow and says we are cutting $580,000 in state aid, that is at no cost to the back of the county.
Okay, and that's kind of that's the gist and the grasp we want to grasp in this exercise is if we're cut, do we still have to deliver and incur expense or not?
No.
So that's the short answer to mental health. What about public health?
So with public health, because of the fact that we are not incurring a ton of expenses, Legislator Peps, that one of our biggest expenses is transportation costs for preschool children who have disabilities. That program costs us about $350,000 a month. We get back about $180,000 depending on the month and how many children are enrolled in Medicaid. We get that money back from the state. However, one of the positives of COVID, because I have to find a positive, is that we have not been paying that transportation cost every month for children to be transported. So we are saving quite a bit of money on that. The other thing that we are saving money on is we have the ability to now do telephonic visits for service coordination. So for our EI 3 to 5 and children with special health care needs, the regulations on telephonic costs have been implemented. So I'm not paying staff time to go and travel to houses. I'm not paying mileage for them to travel. They are sitting in the office when they are here, making those phone calls and being able to bill. So it's not a huge cost savings on mileage and time, but we are able to make telephone calls and get more billables at this point than we would if we had to spend 40 minutes in a car driving to St. Johnsville. So that program, we've been able to save quite a bit of money, and I think you'll be able to see that when we get into the next quarter. Those savings on transportation are going to be huge.
Okay, and
So-
that's kind of what, go ahead.
If I might interject. So what we're seeing is, we may be receiving less money, but certainly we'll have less liability on things, and we're going to have some major adjustments such as the busing, $170,000 a month. Is that a 12 months, Sarah?
It's school year, so we do it. Unfortunately, it's a little complicated. So we do September to the end of June, and then we do the summer program. So it's 9 months, and then July and August.
So there'd be a significant amount of savings with that.
Correct.
And would you expect that with anything COVID related, we should be receiving or hopefully receiving some additional funding for that?
I actually don't think we're going to receive COVID dollars for children with special health care needs, EI and 3 to 5, because we've already received over $100,000 in funding for emergency.
I'm not, excuse me, I'm not referencing the 0 to 5 program. I'm referencing over your total programs. Your major factor of everything right now is you're working on COVID. Do you see additional dollars or funding coming in for that?
But we already got that $95,000 that we recognized last month, plus the $7,000 that we recognized last month. So at this point, I think that's all we're going to be given in this contract year, because that grant ends the end of June. So I think if we don't receive any more money by the end of June, that'll be it for that grant year. But I would expect that we would have other funding coming in by way of FEMA to cover some of the costs for the overtime, reimbursements for the PPE that we've spent. Rick and I have been working diligently to save every receipt so that we can submit that for reimbursement. So in case we do exhaust our grant money, we have the capacity to be reimbursed. But it has been made clear by the state that other programs that are impacted, such as lead, rabies, our STD program, our communicable disease program, they won't be reimbursed any higher than what our state aid is. So as I said earlier, when we hit our $500,000 cap for state aid, once we hit that cap, we can get reimbursed 36 cents on every dollar. So if I have a salary that needs to be paid overtime, I can get reimbursed via state aid 36 cents on the dollar. So we would get that reimbursement. It's not a lot, but historically, we've never hit our $500,000 cap.
All right. Well, Sarah, thank you. Because, I mean, really, what I wanted to get to the bottom of here is, and thank you for making yourself continue to be available.
Absolutely.
Was I wanted to allay our fears as a legislature that, okay, if mental health is cut 20%, these two programs, a total of $711,000, it's not money we need to come up with to bridge the gap to deliver these services. If public health is cut $464,000 or 20% these 5 programs, this is not, our expenses are going to be reduced proportionally, correct?
They're two completely different answers. For mental health, if the state cuts the programs, no, we are not responsible for that reimbursement because that's part of the contract that the county attorney has with us and the agency. So if that aid gets cut, no. With public health, though, if we get cut, we are still responsible for those programs. So if they cut our rabies funding, for example, public health law dictates that we are responsible for costs incurred via as a rabies response. So if we run out of money and they cut our rabies program, yes, the county would have to eat that cost. If they cut our reimbursement for Medicaid and transportation does set up, yes, as you know, that is a cost we would have to incur. So for mental health, the answer is no, we don't have to. For public health, it is yes, we have to incur that cost.
Okay. All right. Thank you.
So Mike, are we okay to say that the 307 and the 403 really could be just taken out of that picture altogether?
Yeah, I think. I mean, that's 711,000 of this 2.948 million. You know, and that's, I mean, but I wanted to hear that right from the lion's mouth here, and I think that's a safe assumption, Chairman or Legislator Hedwell.
And the other thing is I think what she also said was that we're saving how much, Sarah, each month on transportation? About?
I would say it's about 170,000 because we spend about 350, and then after reimbursements, we still eat about 170 a month. So we're saving that now that we have no transportation. But it's different, Legislator Hedwell, every month because it's based on the number of days that the kids go to school. So on those months, like February break, where there is no school, we get off a little bit cheaper. Or Memorial Day, you know, holidays, snow days, we do get off cheaper on those months.
So we're looking at the month of March, April, May, and June, right? Those 4 months. So we could say 150,000 for each one of those months, and that would be on the plus side, correct, Mike?
Yeah. Yep.
So that would be like a plus of 600,000.
Yeah. And then again, looking at summer school, if there is no summer school for this school year, we would be saving on July and August as well. And then September would be another beast.
Yeah. All right. Thank you so much, Sarah. I appreciate it.
Is there anything else you gentlemen need from me?
Thank you for staying with us.
Absolutely. Have a good night, everyone. Thank you.
Thank you, Sarah.
Bye-bye.
And I guess that's the point of all of this that I want to get to the bottom of is as we look at all these categories and go, egads, if we get cut 20%, you know, of our state programs, we're going to be out $2.9 million. Well, the reality of a lot of this, we're not going to incur the expense and we're not going to be out that. I mean, some of these categories, you just heard it. Public health, we need to come up with that 464, those 5 categories there. Mental health, we won't. Social services, that's a whole nother, all those categories in social services there, however many, 3, 6, 9, 10 of them, total about 970,000. It'd be good to get some input from them as to how much of that would actually have to, you know, we'd have to come up with to deliver those services in the event that we got cut 20%. But you know, we can't just look at this as a 20% across the board means, oh boy, you know, we're going to be out all this money because we're not going to incur the related expense. And I guess that's the concept I wanted to get across here. Now, as we go down the second page, the federal, Sean, why don't you pipe in a little bit about this? You put this on here. This is money that the Fed passes to the state, who then passes to us. But you don't think that this $1,996,000 representing 20% costs, 20% reductions in about 10 federal aid social services categories is going to happen, do you?
I don't anticipate it to happen, but like I said, there's always, I would say, games that the state plays with the federal money. So it's possible that the state could withhold some federal funding from being passed down to municipalities. I just don't know the impact yet. And honestly, there really hasn't been a whole lot of guidance out of the state of what they're doing with these social programs.
Okay. And that's all we can really deliver to the rest of the ledge here regarding that federal aid component, correct?
What I can do is I can reach out to DSS to find out if they've heard anything about their reimbursements of if there's going to be any cuts coming in what programs.
All right, please do that for us. And then our last category on this page is the sales tax. And you can see, you know, last year we collected 33 million. We budgeted 31 million. A 20% cut would be 6.2 million. The direct hit to us would be 3.5 million. You know, after, you know, the 2.66 million would be money that the municipalities wouldn't get as a result of the reduction in sales tax. So, you know, take that 3.5 million and let's just say we're down 20%. We took in 33 million last year. So, you know, 3.5 million off of 33 million puts us at 29.5 and about $1.5 million less than we budgeted. So, you know, that's going to be something that is going to sting us. There's no question. Unless we have a ramped up third quarter and a booming fourth quarter, like, you know, some people seem to be discussing, you know, at the federal level. And I don't know whether that's going to be the case. But obviously, that's the single biggest hit we stand to take in any of these categories. And we knew that all along since this happened was going to be the sales tax. But, you know, it's not as bleak, if you ask me, if you do that. You know, for us to collect 29.5 million against a $31 million budget, it certainly is quite different than what's happened the last 5 years that we've been involved here in this second legislature and this third legislature. We've always gotten $1 million to $1.5 million more than we budgeted. So it will break that pattern of us collecting more than we budget, but it hopefully is not devastating. Hopefully. So,
Mike, I think what we're doing right now, though, just keeping an eye on this and looking at the numbers, I think is the best thing that we can continue doing. I mean, and having a real good handle on it. We're not going to change, you know, but at least we'll have a good idea of what's going on and be able to help us make better decisions down the road, knowing that we've watched this every month, you know, as an ongoing thing.
Yeah. Well, I certainly hope so, Legislator Headwell. Any more discussion on this potential state funding cut?
Great job, guys.
No, I think it's been a great discussion.
Okay, well, it's been our discussion, and you know, thank you all for your input and for you know, getting us on this page so that we can continue to look at this throughout the year. Under other, I think we have a matter to discuss that came before us today in the form of discussing the treasurer's penalty on delinquent taxes. You know, Sean did give us a little information today. Sean, can you synopsize for us, you know, first of all, how much we've collected already in 5% penalties? How much in outstanding taxes right now that are delinquent that we would stand to lose if we were to waive it for one person, set a precedent, and then having to waive it for everybody? I you know, discussed this with you today as this email chain was circulating. I think you quoted a figure that we have over $3 million of delinquent property taxes still, that would 5% of which would represent about 185,000.
That's correct. And to date, for just the 1 month's collections, we've collected a little over $260,000, and of that, a little bit over 12,000 is that 5% penalty that we're talking about.
And the 185 would be the 5% penalty on the, what's that figure, 3 million? Do you know the figure?
gotta be close to 400.
It's 3.7 million.
3.7 million in delinquent property taxes right now that we would be that we would collect, if collected, $185,000 worth of a 5% penalty fee, correct?
Right. If you're going to consider waiving this 5%, you're going to lose $185,000 of revenue this year.
Plus rebate the 12 we already did, or refund.
I guess the other side of that is, you know, does that 5% put anybody out of reach for paying their taxes or saying, well, I'll do it at another time? And at that same time, you know, are we not collecting some taxes?
And so just to clarify that this 5% is spelled out in real property tax law, section 936. So it's not just a Montgomery County charge. It's part of the real property tax law that this 5% is added.
I think we keep charging and keep moving ahead.
I agree with Martin.
And like I said, I'll speak freely. Honestly, like I said, the collection rate that the people that have paid on time has been over 91% of the people.
Well, I think
Go
ahead.
And I know people fall on hard times. It happens every year for people. If you do it this year, are you something gonna come up next year where you have to do the same thing?
And what happens to
I know it's a different
year?
situation.
Sean, during your tenure, historically, have we ever done it?
No.
Okay, then that's good enough for me.
Legislator Kelly, you had a comment, sir?
It's a moot point because we're not going to refund people for what they paid their percentage of interest and penalties for not paying on time. It's a moot point. We're moving forward.
I think we should move forward, Mike. New issue, new topic.
No, absolutely. Well, you know what? It got bannered about on email, and we were all going to be together tonight. So I thought, you know, it'd be a good time for us to bring it up and reach a consensus. And if it feels like we have, that we're just going to move forward with the way it is.
Yep.
All right. Any other topics for discussion?
I have one thing, Chair. This is John Taylor.
Yes, sir.
I've been kind of going up, perusing other county budgets, you know, trying to get a handle on some of the things that we might be hit with and seeing if other counties are doing something differently. And one thing that was very striking to me that is somewhat troubling is the fact that I went up on 4 different counties, including our own, and ours was the only one that did not have our approved 2020 budget up on the county website.
Interesting.
So if we could move forward and try to get that up on the county website, I'd appreciate that.
Well, it's a great observation. And Sean?
I'll send Data a message tomorrow and see if they can get that uploaded.
Thank you.
And what tab would it be under? Or
budgets?
Sean, where is it? So we know where to find it.
I believe there is a menu item on the website that has adopted budgets in it.
Okay, excellent.
It's under reports and then budgets.
Okay. Legislator Thayer, thank you for your research and your input.
You're welcome. Thank you.
All right. Any other topics for discussion under budget and finance?
When can we expect a hard copy of the AUD?
I can put them in the mail. I can mail them out to each individual tomorrow.
Are they already on our desks, Cheryl?
No, I have them in my office. If it's up
No,
to you,
they're
I can
not.
either mail them or I can put them on your desk tomorrow.
I think put them on our desk, save the postage. We can come in at our time.
The problem is that the door is locked, and even with your slide card, you're not getting in unless you call.
Call the queen bee.
Martin's the only one that really can't get in.
All right, so
I
Sean,
can deliver to you. I can deliver to you, John Thayer.
Thank you.
How about
You're
if we just
special,
have the,
John, to deliver to you.
how about we just have the sheriff's department deliver it to us?
That may be
Yes.
sooner than later to some of us.
it must be an inside joke.
Well, he's my neighbor and all.
Martin, I can deliver to you too.
So what are we going to do, Cheryl? Just so everybody knows, you're going to mail them, or you're going to put them on the desk and everybody come to you to get in?
It doesn't matter, I guess. You know, I'll be in the office, so if you want to just give me a call when you're in the parking lot, I can bring them out. Or, you know, Martin and John I can deliver to because I go past their houses. I don't care. Whatever you guys want me to do.
I'll
Don't
pick
mail
mine up,
them.
Cheryl. This is
Mike,
your-
I can pick yours up also.
Okay.
Mike, would you
Well,
like
you
me
know,
to
you
pick
don't have
yours
to
up?
because when I did the dashboard Friday with Sean,
You got yours.
I got mine then.
Okay.
So,
Hey,
Chairman
Mike.
Chairman any Mike. Other?
So if you just
Yeah.
let me know who needs it mailed, I'll get them out as soon as possible.
Who else is speaking?
That's me, Chairman Mike. We're gonna have to, if we're gonna have our July meeting in the building, we're gonna have to, I talked to Matt about something about rearranging our tables so that we can do the recommended spacing there. So
Okay.
I think that probably would be for our July meeting, if they open it up by then.
So definitely.
You mean June?
June's off the table, correct or no? Matt, is June off the table?
We have to rearrange.
It appears so. We're still under a 10-person or less order for gathering. So, with Cheryl, that's 10 plus, anybody from the public, we're considered a mass gathering. So as of right now, it's not allowed. They expect to extend the provisions related to open meetings law that are already in place. That hasn't been done yet, but we do expect that. And if I get any information that is different than that in any of my calls, I'll let you know. But they've advised to plan for online meetings in June, and with July being a question mark.
Okay, thank you.
Thank you very much.
All right. A motion to adjourn.
I'll make the motion. Four.
I'll second it.
All right, thank you. 4-1.
Adios.
Thank you.
I guess.
Have a good night, everybody.
Good
night.
Good night.
Nice
Thank
job,
you.
Mike.
Thank you.
Bye, Mikey.
See you, Bobby.